Within the Healthcare Without Walls, we have a program called Bridge to Elders, which is targeting women over 60 years old who are very vulnerable.
This is the population that hardly nobody seems like to see them. These elderly females that have been for many years caretakers.
A lot of us have worked out throughout our lives and have contributed to society. I mean, I worked very, very hard as a mental health worker, and I made a difference.
It was a very, very dark time in my life, and I didn't have health care, and I didn't have anybody to talk to as far as like therapy or anything like that.
We really focus on the individualized care. If they need any health care, do they have a history of domestic violence? Are they at risk? Are they safe?
They also help us make appointments and take us where, or show us how to get places when we're not familiar with the area.
Alina and we work together as a team. Alina being a great community outreach worker, and she's just more than that. She would just stand at the women's lunch place dining area.
Alina found me. She just kind of floated in one day and said, "You need some help."
I was waving to someone, but Alina thought I was waving to her. So she came zooming over to me and whisked me up to the 4th floor there and started getting me all enrolled.
I looked, at them and I said, "Do you want to talk?" And they just come and they just cry their eyes out and they tell me, and then inside my mind, I'm already doing my plan assessment, like initial assessment. Okay, this is what they need.
She just began to offer so much support and help that your sense of hope began to rise.
And then after I write them down, I meet with my colleague, Jeannie.
I do a very thorough physical exam and try to identify what else is there, what else do they need. So we have a very comprehensive intake process.
They first evaluate you and make sure that you get the treatment at the beginning to stop whatever issues you're having, the care you need, and the support.
There was one client, she had a chronic condition of diabetes, and this condition was affecting her vision.
People may not even know that they have diabetes or undetected hypertension. They might even walking around with a heart murmur, not knowing that they have this high blood pressure all their lives.
This lady hasn't been seen like 5 years or 6.
And they might not even know that they're supposed to have a mammogram every year or colonoscopy every 5 to 10 years.
We got Social Security benefits, mass health benefits, and right now I'm seeing her every week, and we're working together with for housing.
It would be a lot harder for me to navigate the healthcare system without the programs here, because I had a lot of difficulties before I came here trying to navigate some of this stuff.
We have a communication between the primary care doctor and us. I schedule the appointment, I accompany them, and sometimes I advocate with the doctor.
But she's very good about going to some doctor's appointments with me when she's able to, and that helps a lot.
I always ask them, did you understand, what benign is? Because most of the women, they say, yes, oh, see, and they don't understand.
To know that medical care is there is huge. And to know that a housing search is being conducted and someone's helping you with it, because otherwise, for me, it would just be a total anathema. I wouldn't know what to do or where to start.
I didn't have an address, so I had a hard time establishing healthcare, without being a resident. But Alina described to me that this was my address. This was my home right now, And we went through the process, and it was very, very difficult.
They know that if we plan something, I want to make sure that the intervention gets done and the objective gets accomplished.
God love her. She was on the phone. It took us days and days on the phone, and sometimes sitting there hours at a time. And I would have given up. I would have just said, forget it. It's never going to happen. but she was insistent.
Homelessness affects you on so many levels, psychological, emotional.
I was very sad, and I was in a lot of pain, a lot of physical pain, and a lot of emotional pain.
You may lose your self-esteem, and you're fighting to keep your sense of self.
Without benefiting from this, I'd be a lot worse off than I am now, and I wouldn't have the self-confidence and feel as good about myself as I do now.
The program here helps with that sadness, loss, and grief that we all experience when we find ourselves homeless. So I think this program is just absolutely essential and so crucial for all of us, all the women who come here.